Now let's cover the use of the automated external defibrillator, or AED, on a child for the healthcare professional. A couple things to talk about are the different size pads you might find inside of an AED. There are adult size pads and there are infant or pediatric size pads. Pediatric size pads are designed to be used in patients who weigh less than 55 pounds or approximately 25 to 27 kilos. If they are bigger than that, you would use the adult pads. Now, one point to make. If the AED doesn't have infant pads and the patient is less than 55 pounds, you're still going to use the adult size pads. It's better for the outcome of the patient to use the larger pads than it is to not use the AED, simply because we don't have the right size pads for the right size patient. So keep that tucked away in the back of your head as we go through this scenario. Now, we're going to check for scene safety. Gloves are on, rescue mask is available with a one-way valve. But in addition, because we're using an AED, we're going to make sure that there's no combustible gases or liquids and no standing water that connects the patient's body to the rescuer's body. If either of those two dangerous environments existed, we would pull or drag the patient to safety, pull them out of that scenario so that we don't have to worry about explosive things, we don't have to worry about electrocutions from water. We can now use the AED safely. Now, people ask me this quite a bit. What if their clothes are wet? What if they're still wearing their bathing suit? That's okay. We don't have to take wet clothes off to be able to use an AED. It's only standing water that we're really concerned about. Once we've bared the chest, if their chest is wet, we can dry off their chest enough that the pads will adhere to the skin of the chest. But other than that, they're fine. So let's begin with the other skills. Our scene is safe, our gloves are on, my rescue mask is available, and now I'm going to call out to my patient. Patient, are you all right? Are you okay? They don't respond. Now I'm going to put a hand on the forehead and tap on the collarbone. Are you all right? Are you okay? They don't respond. Activate EMS, call 911 or call a code. If you tell a bystander to go call 911 and come back, have them bring an AED if you don't already have one. In this case, I brought the AED with me, and therefore I don't really have to have them bring one to me. Now I'm going to go ahead and assess the child by head tilt chin lift, looking for normal breathing and checking for a carotid pulse. Remember that the carotid pulse is located between the trachea and the sternocleidomastoid muscle in that valley that lies between those two features. The patient does not have a pulse and the patient is not breathing normally. I'm going to turn the AED on.
Remove clothing from person's chest.
I open up the shirt.
Attach pads firmly to person's chest as shown.
I pull out the appropriate size pads and I attach them to their chest as shown. One goes above the right chest. The other goes mid-axillary line on their left side, just below the breast. Make sure the pads adhere well. Now, plug it in.
Pads. Plug in. Analyzing rhythm. Everyone stand clear.
Do not touch the patient.
Shock advised. Charging. Everyone stand clear.
Clear.
Everyone stand clear. Push the shock button.
I'm going to push the button.
Shock delivered. Begin 5 cycles of CPR.
Now I go into my 30 chest compressions. A third of the depth of the chest at a rate between 100 and 120 compressions per minute. After I do my 30 compressions, 25, 26, 27, 28, 29, 30, I use my mask, head tilt chin lift, and deliver 2 rescue breaths. I know they went in because I saw the chest rise and fall. 5, 6, 7, and 8, 9, 10, 11, 25, 26, 27, 28, 29, 30.
Analyzing rhythm. Everyone stand clear.
No matter where you're at, you stop what you're doing and let it analyze.
Shock advised. Charging. Everyone stand clear.
Everybody clear?
Everyone stand clear. Push the shock button.
I'm going to push the flashing button.
Shock delivered.
Right back into my
5
chest
cycles of
compressions.
CPR.
And I'm going to do this 30 chest compressions for 2 rescue breaths, and I'm not going to stop until EMS arrives, until someone equally trained or higher takes over, or until this child responds and revives.